heart attacks. Start in your ankles. Watch for this before it's too late. Senior health. Most seniors watch for chest pain as a heart attack warning. But the first danger signs often appear in your ankles and legs months or years earlier. Since your feet are farthest from your heart, they show circulation problems first, like canaries in a coal mine. The same process happening in your ankles is also affecting your heart vessels. Doctors rarely check your feet carefully during checkups, so these warning signs go unnoticed. Learning to spot these ankle signals yourself could save your life by catching heart problems before they become emergencies. Tell us where you're watching from. We read every comment. And don't forget to subscribe. Now, let's explore the first critical sign in your ankles that might be warning you about an impending heart attack. Sign number 1, persistent ankle swelling. The fluid warning signal. That persistent puffiness around your ankles isn't just from standing too long. This swelling, called edema, happens when fluid leaks from blood vessels into surrounding tissues. For older adults, this often signals that your heart isn't pumping effectively. When your heart weakens, it struggles to circulate blood properly. This creates backward pressure in your veins, forcing fluid into tissues, most noticeably in ankles and feet, where gravity naturally pulls fluid downward. This pressure buildup occurs throughout your circulatory system, including vessels supplying your heart muscle. What makes ankle swelling concerning is how easily it's dismissed. Many seniors think it's normal aging, standing too long, or hot weather. Even some healthcare providers might miss its significance if they don't connect it to other subtle symptoms. The swelling usually begins gradually. You might notice socks leaving deeper marks, or shoes feeling tight by evening. If pressing your finger into the swollen area leaves a dent that slowly fills back in, called pitting edema, this isn't something to ignore or blame on aging. Even more revealing is when this swelling improves with leg elevation, but quickly returns when standing. This pattern suggests your circulatory system struggles against gravity, a potential warning sign for heart problems that could lead to a heart attack if untreated. To check for this warning sign, press your thumb against your ankle bone for about 5 seconds, then release. If an indentation remains for several seconds, this fluid retention might indicate your heart needs attention soon. Remember this. Persistent ankle swelling that leaves a dent when pressed could be an early warning that your heart is struggling and needs medical attention. Sign number 2, slow healing sores and discoloration. The oxygen deprivation alert. Those small cuts or bruises on your feet and ankles that take weeks to heal aren't just annoying. They're sending an important message about your heart health. When wounds on your lower legs linger much longer than they should, your body is signaling something serious about your circulation. For wounds to heal properly, tissues need good blood flow carrying oxygen and nutrients. When your heart isn't pumping efficiently, or your blood vessels are narrowed by plaque buildup, the same process that leads to heart attacks. Healing slows dramatically in areas farthest from your heart. This delayed healing often affects seniors because blood flow naturally decreases somewhat with age. Besides slow healing wounds, you might notice subtle skin color changes around your ankles and feet. A bluish or purplish tint shows oxygen-poor blood, while reddish-brown discoloration means blood is pooling instead of circulating properly. Some older adults develop shiny, thin skin over their ankles and feet as ongoing poor circulation causes tissue changes. What many don't realize is that this same oxygen shortage happening in your ankles is likely occurring in your heart too. The same process limiting blood flow to your extremities is simultaneously affecting the coronary arteries that feed your heart muscle. By the time you notice these skin changes, the problem has typically been developing for months or years. The connection is clear. Your cardiovascular system doesn't develop problems in just one area. The same plaque buildup that affects blood vessels in your legs happens throughout your body, including the crucial arteries that keep your heart functioning. For people with diabetes, this warning sign needs even more attention. The combination of diabetes and heart disease speeds up oxygen deprivation to extremities and greatly increases heart attack risk. Watching how quickly minor injuries on your lower legs heal gives valuable insight into your overall circulation quality. In summary, wounds on feet and ankles that heal slowly may signal poor circulation that's also affecting your heart, potentially leading to a heart attack. Sign number 3, coldness and numbness. The circulation restriction signal. Constantly cold feet and ankles aren't just uncomfortable or a normal sign of aging. They could be warning you about problems with blood flow throughout your body, including to your heart. When your feet stay cold, even in warm rooms, your body is sending an important signal about your cardiovascular health. This persistent coldness happens because narrowed or hardened arteries can't deliver enough warm, oxygen-rich blood to your feet and ankles. Doctors call this peripheral artery disease PAD. It's caused by atherosclerosis, the same fatty buildup in arteries that leads to heart attacks when it happens in the vessels feeding your heart. Studies from the American Heart Association reveal that older adults with PAD face a 2 to 6 times higher risk of heart attack and stroke. This connection makes perfect sense. The same process causing coldness in your feet is likely happening in the arteries supplying your heart muscle. It's essentially the same disease affecting different parts of your body. Besides coldness, you might notice numbness or tingling in your feet and ankles before any chest pain appears. This occurs because reduced blood flow deprives nerve cells of oxygen, changing how they work. You may have trouble feeling when something touches your feet, difficulty sensing temperature changes, or strange pins and needles sensations that come and go. What makes this warning sign particularly valuable is how early it often shows up. Many older adults experience cold extremities years before developing chest pain or other typical heart attack symptoms. This gives you precious time when lifestyle changes and medical treatments can be most effective. Checking for this sign is easy. Compare how warm your feet feel compared to your calves or thighs. Your entire leg should have similar warmth. If your feet and ankles feel noticeably colder, especially if they look pale or bluish, your circulation is compromised, and that same problem might be affecting your heart. Don't dismiss chronically cold feet as just another sign of getting older. They could be telling you something important about your heart's health before more serious symptoms develop. Let's go over that again. Persistently cold feet and ankles may signal arterial blockages that could also be restricting blood flow to your heart, significantly increasing your risk of a heart attack. Sign number 4, night cramps and restless legs. The oxygen debt warning. Those painful leg cramps that wake you at night, or the restless, uncomfortable feelings in your legs while trying to sleep, aren't just random discomforts. For many older adults, these nighttime leg problems can be early warning signs of heart issues that might eventually lead to a heart attack. These sensations typically happen because your leg muscles aren't getting enough oxygen during rest. When you're active during the day, your muscles demand more blood, and your body works around minor circulation problems. But at night, when blood pressure naturally drops, poor circulation becomes more noticeable, especially in your legs and feet, which are farthest from your heart. The link to heart health is clear. These cramps and restless feelings often signal narrowed arteries from plaque buildup, the same process that causes heart attacks when it happens in the arteries feeding your heart. Research in the Journal of the American Heart Association found that older adults with frequent night leg cramps had much higher rates of heart disease, even without other symptoms. This warning is particularly of importance because it often shows up earlier than typical heart symptoms. The smaller blood vessels in your legs may show signs of plaque buildup before the larger heart arteries develop obvious problems. This gives you important early warning when preventive action works best. The pattern of these symptoms tells an important story. Many seniors notice the cramps or restless feelings get worse when lying flat, as this reduces gravity's help in blood flow to the legs. Hanging your legs over the bed edge or walking briefly often helps by using gravity and muscle movement to temporarily improve circulation. For those taking blood pressure medications, these symptoms need special attention. Some medications lower blood pressure more at night, potentially reducing oxygen delivery to your limbs. If night cramps began or worsened after starting blood pressure medication, this timing might offer important clues about your heart health. Simple steps like gentle stretching before bed, drinking enough water, and maintaining proper salt balance can help manage symptoms. However, addressing the underlying circulation problem is essential for both comfortable legs and protecting your heart. Don't forget that nighttime leg cramps or restless legs may signal poor circulation that could also be affecting your heart, serving as an early warning before more serious cardiac symptoms appear. Sign number 5. Hair loss and skin changes on lower legs. The silent circulatory decline. The gradual loss of hair on your feet and lower legs, along with changes in skin texture, might seem like minor signs of aging. However, these changes often signal a significant decrease in blood flow, the same process that can lead to a heart attack when it affects the arteries feeding your heart. When blood supply to your lower extremities decreases, hair follicles suffer first. They need good circulation to maintain growth. As blood flow diminishes due to narrowing arteries, hair growth slows and eventually stops, typically starting with the feet and ankles before moving upward. Many older adults think this is normal aging, but hair loss on both legs often points to a circulation problem. Besides hair loss, the skin on your lower legs and ankles may become thin, shiny, and tight-looking. This happens because reduced blood flow limits the delivery of nutrients needed for normal skin renewal and collagen production. Some seniors also find their ankle skin bruises more easily and takes longer to heal. These skin changes usually develop slowly, making them easy to miss unless you're specifically looking for them. The medical importance is significant. Studies show that visible leg hair loss strongly connects with artery disease throughout the body. Research in the American Journal of Cardiology found that among older adults, those with hair loss on both legs had about twice the risk of heart disease compared to those with normal hair growth. This connection makes biological sense. The same plaque buildup process that restricts blood flow to your legs is simultaneously affecting arteries throughout your body, including those supplying your heart muscle. By recognizing these external signs, you gain insights into internal heart health that might otherwise remain hidden until a crisis occurs. What makes this warning sign extremely valuable is how easily you can see it. No special tests needed. Simply examining your ankles and lower legs occasionally can provide important information about your circulation quality. If you notice progressive hair loss or skin changes, especially with other warning signs mentioned earlier, your cardiovascular system is sending an important message. Simply put, loss of hair on both legs and changing skin texture could reveal poor circulation that might also be affecting your heart, doubling your risk of a heart attack. Sign number 6. Visible veins and spider veins. The pressure buildup indicator. Bulging veins and tiny purple spider veins around your ankles might seem like just a beauty concern, but they can actually warn you about heart problems. When these veins become easy to see, your body is trying to tell you something important about your circulation. These visible veins happen when the small valves inside them get weak. This allows blood to pool instead of flowing properly back to your heart. This extra pressure makes the small veins near your skin show up more. For older people, this is important because these vein problems often connect to heart strain. Most people don't know that vein problems and artery problems often go hand in hand. Studies show that older adults with visible ankle veins have about 27% higher risk of developing artery disease, which can lead to heart attacks. This makes sense because both conditions involve weakened blood vessels and poor blood flow. Where you see these veins matters. When they appear around your ankles and lower legs, it often means your heart is having trouble pushing blood upward against gravity. This same struggle can affect how well your heart muscle itself gets oxygen. The tiny spider veins, those small purple or red web-like patterns under your skin, need special attention too. Though many think they're just cosmetic, they often signal wider circulation problems. Research shows that having many spider veins around your ankles is linked to conditions that make your heart work harder. If you take heart medicine, watching these veins can tell you how well your treatment is working. If ankle veins become more visible, you might need to talk with your doctor about adjusting your medicine. Don't forget what we just said. Visible veins around your ankles aren't just about looks. They could be warning you about poor circulation that increases your heart attack risk by almost 1/3. Sign number 7, abnormal pulse in ankles. The rhythm disruption alert. The strength and regularity of the pulse in your ankles provides crucial information about how effectively your heart is pumping blood through your entire circulatory system. A weak, irregular, or difficult to find ankle pulse often appears long before more obvious heart attack warning signs. Your ankle pulse, technically called the posterior tibial pulse, can be found by pressing gently behind your inner ankle bone. In healthy circulation, this pulse should be relatively easy to locate and should have a steady, consistent rhythm similar to the pulse in your wrist. When this pulse becomes faint or irregular, it suggests that blood isn't flowing optimally through your lower extremities. This warning sign is especially helpful because it clearly shows how well your heart is pumping blood. Your ankle pulse is essentially your heartbeat felt at the furthest point of your arterial system. Any weakness or irregularity here typically reflects a problem affecting your entire circulatory system, including the coronary arteries that feed your heart muscle. Many seniors are surprised to learn that cardiologists often check ankle pulses as part of cardiovascular assessments. The ankle brachial index, ABI, a comparison between arm and ankle pulse strength, is a validated predictor of heart attack risk. Research shows that seniors with abnormal ABI readings have up to 4 times higher risk of cardiac events even without other obvious symptoms. The pattern of pulse changes can reveal specific types of circulation problems. A pulse that's present when lying down but disappears when standing might indicate positional blood flow restrictions. A pulse that's irregular in rhythm might reflect underlying heart rhythm abnormalities that could eventually lead to more serious complications. What's particularly concerning is that many seniors never think to check their ankle pulse, missing this early warning sign entirely. Checking your ankle pulse weekly provides a simple, no-cost way to monitor a key indicator of your cardiovascular health. If you notice your pulse becoming more difficult to find or changing in strength or rhythm, it's time for a professional evaluation. Here's the takeaway. A weak or irregular ankle pulse may be an early warning sign of poor circulation and heart problems, potentially indicating a 4 times higher risk of heart attack even before other symptoms appear. Sign number 8. Ankle crackling and stiffness. The inflammatory connection. That strange crackling sensation when you rotate your ankles, along with increasing stiffness, might seem like ordinary joint problems. However, for many seniors, these symptoms actually signal inflammatory processes that affect not just your joints, but your entire cardiovascular system, including your heart. When your ankles develop a crackling sound, medically termed crepitus, accompanied by stiffness, inflammation is often the underlying cause. What many don't realize is that this same inflammation that affects your ankle joints is likely present throughout your body, including in the blood vessels feeding your heart. The connection between joint inflammation and heart disease is well established in medical research. Studies published in the Journal of the American College of Cardiology show that seniors with inflammatory joint conditions have significantly higher rates of heart attacks and strokes. This happens because the inflammatory compounds that damage joints also promote atherosclerosis, the narrowing and hardening of arteries that leads to heart attacks. Ankle swelling often shows up first among joint problems because these joints handle the most stress every day from walking and standing. For many seniors, ankle stiffness and crackling sounds precede more obvious inflammatory symptoms like pain or swelling. By recognizing these early signs, you gain valuable time to address the underlying inflammation before it significantly damages your cardiovascular system. Morning stiffness in your ankles deserves special attention. If your ankles feel particularly stiff and tight for more than 30 minutes after waking, systemic inflammation is likely present. This same inflammatory process could be simultaneously affecting your coronary arteries, increasing your heart attack risk over time. For seniors taking anti-inflammatory medications for other conditions, monitoring ankle stiffness provides valuable feedback about how well these medications are controlling your overall inflammatory status. Decreasing stiffness and crackling suggests your current approach is working, while worsening symptoms might indicate the need for treatment adjustments. Bottom line, crackling, stiff ankles aren't just joint problems. They may signal inflammation throughout your body that could be damaging your heart and increasing your risk of a heart attack. Which of these ankle warning signs have you noticed, but perhaps dismissed? Have you experienced any changes in your ankles that concerned you? Share your experiences in the comments below. Your insight might help someone else recognize these crucial warning signs before it's too late. And don't forget to subscribe for more potentially life-saving health information specifically designed for seniors. Your heart health journey matters to us, and we're here to support you every step of the way.